Hello, my good people. How are you doing? Hope you're well. I'm well myself. Good morning, good afternoon, good evening, whichever time of the day that you are watching this video. I welcome you back to my YouTube channel. My name is Jemmy Naftali. I am a pediatrician by profession. So here in this platform, I normally share videos on about children, the newborns and children. So everything that you need to know about children, I want to keep educating and reminding everybody what really happens to these children while growing up. I want to involve everybody into the management of these babies because it is good. Knowledge is power. So welcome again to this channel. Subscribe if you haven't subscribed. Subscribe to be part of this wonderful family. This is a family and we want it to be as big as possible. If you're that returning subscriber, thank you so much for always coming back to watch my content. I do not take it for granted. Thank you so much. I really appreciate. So welcome to today's video, and in this video what I want to talk about is those things that mother really gets scared about, yet they are very normal in newborns. A newborn is that baby that has just been born. So they have got so much happening in them and they come as symptoms, and this really worries mothers. This is what I want the mothers to know, that this what worries you. Most of these things are very normal and we don't even need treatment for these things. So number one, if we may start from head to toe. So when a child is born, you may find that the child has got a swelling around here, and this mostly we call it caput succedatum. And there's a video I did because there are two types. You have caput succedatum and you have cephalohematoma. So those are two types of the swellings that a newborn may be born with. So go back to my videos, check on those and get to know the difference between the two. So the caput, we normally say caput succedatum. So normally it's as a result of molding. When this baby is coming out from the birth canal, so there's that molding and the baby gets to be squeezed, and now the head gets a very scaring shape. Yeah, so this really scares mothers so much. So I'm here to tell you that this is normal. What we do, the treatment we are giving to all these things that I'm saying are normal, is something we call reassurance. We want to reassure this mother because they are so scared. We tell them give it some days, it is going to clear, and if you feel it has not cleared after some few days, you can come back for review, but we normally don't give any treatment. Yes, so that is number one, the swelling around the head. Now we are saying it could be caput or it could be cephalohematoma. So go back and check the differences between the two. Going downwards now, the eyes we have got, newborn babies have got mostly swelling around the eyelids here, and other times even the mother tells you that my baby is not opening the eyes. So here you just again reassure. If you check on the eyes, there's nothing wrong. So you just tell them this swelling is going to disappear on its own. The swelling just resolves on its own. So you just reassure the mom, give it some few hours, few days, and the baby opens their eyes, and this is very normal. Another thing in the eyes, it's a spot, normally a red spot inside the eye. So this is again something to reassure. There's nothing to worry about. The mother should know that this is very normal. So what we don't want to see in these eyes is the yellow discoloration in the white part of the eye, the sclera. Remember, we called this jaundice, and we always mention about jaundice. Go and check what jaundice is and what we go about it, because I've really talked about this jaundice. So it's only the yellow discoloration that we don't want to see inside the eyes. And also if the child is having now eye discharges, the whitish discharges when the child is waking up. So now those are things to worry about. But just swelling around the eyelids and also having a red spot inside, this is very normal. We again reassure the mothers. Hope it is very clear. Now something else is a rash. A newborn is likely to get a rash on the face, around the neck here. So this rash most probably is a heat rash. So as long as it doesn't have pus, if it doesn't have pus, it's just a rash around. What we tell mothers is to not overclothe the baby. We expose the face of these babies because this is heat. This is called heat rash. We are saying as long as it doesn't have pus. This is very, very normal, mothers. Yeah, no need of getting scared. Now, when we go to the mouth, what do we see? Normally inside the mouth, you're likely to find that at the gums of this baby's mouth, there's some swelling, yes, a whitish swelling inside, either on both sides at the corner and another one on the corner. Mothers get so scared. Then this is as a result of most of these things are hormonal. Remember, this baby was inside the mother's womb. Now it has come out. Try now to adjust to the new environment. So the hormonal changes from the mother's womb now outside is what is giving us most of these changes that really scare mothers. So those whitish, we call them sometimes false teeth. So we do not do anything about them. Don't go to the pharmacist to buy things to apply. Other things, we had some instances whereby mothers, when they see this, they go to the villages to do the traditional things. That is so wrong. You go and do the traditional thing of cutting that thing out. And what happens? They bring back these babies when they are very, very sick. Why? Because the procedures that were used there are just, it is full of contamination. These things that are used to remove these things are not sterile. So babies come back, they're not breastfeeding, with a lot of fever, and we end up even admitting them to hospitals. This is something that you could have left it on its own to clear. Now you went to look for the kienyeji things, if I may call them that. So please stop doing those things. This is something that is hormonal and it's very, very normal. Just reassurance. Leave it alone and it's going to clear on its own. Another thing that scares mothers is newborn babies, how they breathe, especially when they are sleeping. So the mother will watch this baby while sleeping and find that sometimes they breathe so fast, other times they stop, they again restart. So normally this is normal to babies, as long as we don't have, it's not something that it's scaring and you don't hear those sounds. Yeah, so a baby will sleep, you don't find them even breathing. Then after some times they come back and breathe so fast, and then they stop. So this again scares the mothers. They come running with the babies to the hospital. We do the checkups and there's nothing wrong with these babies. Others say that when they are sleeping, they are producing some sound. It's very, very normal. It's very normal. If this baby is breastfeeding, it's very, very normal. So again, that is okay. You do not have to worry about anything. Yeah. Something else, it's a whitish discharge, especially from a female neonate. So a female neonate, around the genital area, you're likely to find some discharges. It's very mucoid, a discharge, and the mothers come running to hospitals again. This is very, very normal, mothers. I know that could be scaring anyway, especially to first mothers, yeah. So what we tell them is just to leave to just wipe that discharge every time they see it with a soft, clean cloth. So just mark my words, you don't use any cloth, just use a clean and very soft cloth to wipe this discharge. It is going, give it some days, sometimes it's going to clear on its own. Again, it is hormonal, so this is something that really scares the mothers so much. So please note that, don't go to hospital. Others try now to go to the pharmacies, do the over-counter drugs. They get antibiotics. They think that is an infection, a UTI. Where did this baby get a UTI from? Where did it get this baby newborn that is barely 1 week or few days old getting the urinary tract infection from? But anyway, I understand a lot of you so much. So instead of going to those pharmacies and buying the drugs over the counter, you find that you just get the drug and give the baby unnecessarily. These babies are very sterile. Yeah, they're very, very sterile. They don't have most contaminations, very, very clean. So this is something to clear on its own. Remember, when you give those antibiotics unnecessarily, these kidneys, these livers are immature, so they are not mature yet to hold and absorb and even excrete the kidneys, to excrete these drugs, and we eventually start having problems with these babies. Remember, we say we want to only breastfeed these babies for the first 6 months, and this is the exclusive breastfeeding. Remember, the breast milk also is a drug and is going to clear all these things out. So don't rush into giving those antibiotics. Come to hospital, let's do the checkups before we give you the antibiotics. So that is it. Those are some of the things that I have seen, I've experienced in my practices, mothers coming back because of such instances, and the only treatment that we give them is reassurance. Tell the mothers, go home, relax, this thing is going to they're going to clear on their own. Yeah, I hope this is clear. If you didn't know, now you know. So share these videos widely. Maybe somebody else needs to hear this. I am saying that especially the first mothers, they need to hear this and stop worrying. They have a newborn, they really don't know where to start. Share the videos widely so that they can hear that this is very, very normal. So thank you so much for always keeping tuned. Continue subscribing. Big number is watching my videos, but they haven't subscribed. I don't know what is happening. Please subscribe to be I want us to be a large family. Also, turn on your notifications to know every time I'm posting a new video here. Thank you to those that are commenting in my comment section. In my email, they're still coming into my email, asking questions and asking even clarifications. You're free to do that. Yeah, my email is provided in the end of this, in the end of the videos every time. So always ask questions. We want in the end to have healthy babies. We also want to improve their qualities of life. So thank you so much for listening. Watch until the end. Till next time. Bye bye.